Hi, my name is Natasha Tracy, and this is the Bipolar Burble. Today I want to talk about psychiatrists and bedside manner. So I have seen many psychiatrists, and I'm not sure that any of them have had a decent bedside manner. I once wrote that a past psychiatrist of mine was similar to a lamppost. She was really cold and rocky. I think that describes most of the psychiatrists I've seen, actually. And recently I had an interaction with my psychiatrist that I want to talk about. So I went to the appointment and we discussed many things, but I was in a really bad place. And I was explaining to the psychiatrist what a bad place I was in. And I was crying and it was really horrible. I was really upset. And I even told him I was suicidal. And the only thing he said to me was, "Natasha, not really anything we can do to help." It felt like he was stabbing me while simultaneously telling me to, yes, please go kill yourself now. And I'm sure that's not exactly what he meant. I would imagine he was being factual, as in, we've tried everything, not really sure what to do right now, go home and don't kill yourself. I'm guessing that was more along the lines of what he meant, but it's not what he said. And it certainly isn't the feeling that I got from it either. And bedside manner is about that. Bedside manner is about the feeling that you get when you talk to your doctor. And I guess that many psychiatrists don't feel that this is important. Certainly if they feel it's important, they're failing. So my guess is they don't think it's important. But for people with a mental illness, I would argue it's extremely important. If you're in there and you're feeling terrible and you need a little bit of reassurance, that person is the only one there to offer it to you. At the end of the appointment, I said to him, "Is there anything I can be looking forward to?" And I meant that in terms of treatment. Is there anything coming out? Is there anything new, et cetera, et cetera? And he said, well, in a few years, I think the research on psychedelics is promising. And again, kind of a bad example of not reading the room. I was looking for some kind of hope to hang on to, and he was basically telling me there isn't going to be any for years. Again, probably not what he meant, but definitely how it felt. So what I basically want to say is to the psychiatrists out there, please try harder. I know that your job is hard, and I know it's difficult dealing with seriously mentally ill people all day long. And I know there's such a thing as a patient-doctor boundary, and I know that you're trying to protect your own emotions by not being emotionally available to us. I get it. I get all of that. But I also think that it's part of your job to actually treat us like we're more than petri dishes. We're actually humans, and we really hurt. And that pain is actually really important, and it should be important to you. My name is Natasha Tracy, and for more on this topic, please click the link below.